Hello, I'm Dr. Danaway. So you may have seen my post about calcium deposits and where those tend to end up in the body and how that can mess you up. So this week I'm kind of on a kick of talking about the different obstructions in the body because I see it over and over and over again, patient after patient after patient coming in with the same exact condition, except for it's 20 conditions or it's 10 conditions. And today the topic is phlegm. So it doesn't mean that every single thing I'm talking about here somebody will have, but sometimes they have different aspects. Um, so when we look at a person coming in with phlegm buildup in their body, first when I'm asking them, I'm thinking about all these different areas. So phlegm can be in the ears. You can be having tinnitus, like that ringing in the ears. You can not be hearing people. It can be in the ear canal, like there's a lot of wax buildup. It can be in the middle ear, which just blocks everything. And so it's like, well, how do we get that out? How do we keep it from forming is one thing. And then how do we get it out? We don't want to have no ear wax, but we don't really want a ton of it. And we don't want phlegm built up in our middle ear and us thinking that we have these major conditions that are in fact are just obstruction in our way. Then you think of just allergens and phlegm and things that get caught in it. Sometimes people with the itchy eyes with the allergens. The sinuses can get quite clogged up, so a lot of people have this issue. They might have a runny nose. It might not want to come out actually. Sometimes there's more like visible phlegm they can get out, and sometimes there's more just the tissues are inflamed with gunk inside them. This can lead to postnasal drip, so that's like when you wake up in the morning and you got that block of gunk in the back of your throat and you got to get it up. If you don't get it up, I would suggest you start doing that because you don't really want it going back in your body, because then we have to work on more what's going to clear that out. Then when you look at polycystic ovarian syndrome, so that doesn't actually even necessarily mean there's a phlegm issue in a woman's ovaries, but it can, because that's one of the possible symptoms. That if you have a certain number of symptoms, they call it polycystic ovarian syndrome. So with that, it's interesting because you've got like the sugar issue, so the gunk built up around that way, which gloms onto your little red blood cells and on your nerves and all these things, causing dysfunction. You get the lipids, so the lipids that are too high, that are the inflammatory lipids that like to glom onto things, as opposed to the lubricating lipids that we tend to need more of. So those inflammatory lipids will make plaques in your arteries, and these can break off and cause a heart attack and a stroke. These lipids will cause, the classic cortisol stress belly, or a beer belly, as we also call it, because it's not always somebody being stressed, and sometimes they're just not working out and eating cruddy. And then you've got phlegm in other areas of the body as well. That can be a little bit more complicated to talk about, so I don't really want to go all over the place with it. But when we're looking at phlegm, we need to think of, one, are we putting things in our body that are causing this phlegm? So these simple carbohydrates and sugars, we get a large amount of those in our diet often, especially in America, and then we end up with our lipid levels being off and our blood sugar being all over the place, and we've got phlegm all throughout our body. This can lead to foggy thinking. So it's like, well, you think, oh, maybe just your sinuses are getting clogged up. No, you're probably not thinking as well. Just like when you get a respiratory infection, people usually aren't thinking that well. But it doesn't have to be an infection. It can be just having all these extreme allergic reactions because the allergens aren't being cleared out in your body. I mean, there's preparing the tissues so that they heal, so you stop having so many reactions to so many things for so long. But then there's also just them being caught in your body, so your body's going to keep on trying to attack. So when we're thinking about how do we change this, well, so one's the diet. You want to make sure you're not having too many of these inflammatory fats, like the what's in like chicken and beef and red meat, pork. egg yolks, though egg yolks have some really great benefits as well, though just, you know, you don't want to load them necessarily. And that you're not having a lot of these carbs that turn to gunk in your body. So, you know, maybe a little bit of quinoa, a little bit of brown rice, a little bit of steel cut oatmeal, but none of the simple carbs, and just a teensy bit of the complex carbs. Another thing with clearing out the phlegm is sulfur compounds. So you want this sulfonization to be going on in your body. So like N-acetylcysteine is a big part of this biochemical pathway. So in a lot of cases, I'll literally give that to patients. We'll usually start out with smaller doses because I don't want them making sulfury toots. As we all probably know what that smells like. And we want the body revved up and ready to go with that. But there's a lot of other compounds that help with that as well. When we look at diet, onions and garlic are really good options, except for onions aren't the greatest option for certain gallbladder disorders. But garlic tends to be a really great option for most people. Besides it, you know, helping as a sulfur compound inside it, it also is antimicrobial. It helps lower blood pressure. It does a lot of other things, you know, just like diet tends to help lower blood pressure. And so when we're also thinking of not getting gunked up inside, we have to think that our body needs to know that we've got nice stable blood sugar levels. So it doesn't think it needs to pile on this gunk, so pile on fat deposits in places. So with that, you want to have enough protein. I personally recommend people have at least their body weight in grams of protein a day. That can take quite a lot to adjust to for a lot of people, but it can be worth it. And then when we're talking about carbs and like, not wanting to have too many and having it gunk up our arteries and things like that, dietary fiber isn't what I'm talking about here, though it's technically a carb. It's more dietary fiber acts as something to basically act like weights for our gut, so our muscles in our gut don't go lax, and so we can still have good healthy bowel movement, so it doesn't get all funky down there, which nobody really wants, you know. So that's the major part of what I wanted to talk about. Just a brief tidbit and summary about all this, because people tend to have all these conditions, and sometimes they come in and I'm asking them about all these things, like, wow, you want a lot of details. And they don't realize till we get to the end that this all connects. So they've been dealing with all these different problems. Maybe they literally thought they were going deaf or had some neurological issue because they're ringing their ears. Not saying that that can't happen, you know, but often it's not what's happening. They're having weight issues and all these things, and they, you know, maybe they've got ovarian cysts and these hormonal issues, and they don't realize that it all relates often. So just wanted to give you a little bit of education. I encourage you to like this video, follow me on Instagram and YouTube, and have a great day.